Hello and welcome to another edition of NHIS in a week. In the headlines, Deputy CEO for HR and Administration takes staff through emotional intelligence training. Training and Development Directorate poised on building capacity of staff. Various directorates of the authority also organized training workshops for staff. Farm Access Leapfrog to Value CHAG and NHIA holds workshop. Now to our first story. The Deputy CEO in charge of HR and Administration, Mrs. Yapokuabedin, took staff from the Administration HR Division through an emotional intelligence training exercise at the head office in Accra. The aim of the training on the subject matter was the tremendous impact emotional intelligence will have on one's professional success and the success of the organization.
You have to really look at improving non-verbal communication. But for the social awareness, something that you should also look out for is to listen and watch. And that is the non-verbal communication. You listen to people and you watch. And you also demonstrate empathy towards people. That's why I said you should look at the environment you see yourself and understand and express gratitude or empathy when you need to.
The CEO of the authority, Dr. Okoboy, who was also present at the training, emphasized the need for the training at this time.
Learning means that we are humble enough to know that we might have some deficiencies in some areas. Once you assume you know everything, that is the day you start getting into trouble. And I'm happy that our DC Admin HR has taken a giant step in making sure that we get busy this morning with learning. Let's give a round of applause.
He charged staff to use the skills acquired at the training to create better satisfaction for members of the scheme and prospective members alike.
Let's work in a way that would guarantee happiness for all of us. If you are not ready to sacrifice to make someone happy, when it gets your turn, others might not be happy. They might not be willing to sacrifice to make you happy. The fact that all is cool with you today doesn't mean tomorrow you will not get issues. And so because of tomorrow, be willing to step out of the rules.
Staff who benefited from the training exercise took turns to demonstrate their knowledge acquired.
With Ghana card, you will be able to use the NHIS app. And the fact is, not everybody has got Ghana card, or even per the requirements, not everybody now can get Ghana card. So if you are 15 years or below, you cannot get Ghana card. So what it implies is that there will be a lot more people who will need NHIS membership or will need to be registered onto NHIS, but will not have Ghana card to be able to use the app. So these people will be served in our offices, and so staff will be in the offices serving them. Worst case, if it so happens that everybody has Ghana card and we are all going to use the app, which is not realistic anyway, then our staff will be deployed to the facilities to ensure that our members or the clients we serve, the reason why NHIS exists, are giving the best of experience at the provider site.
Self-awareness, that's the self-perception. With that one too, we will advise staff that they should get in tune with their fears. When you are in tune with your fears, you become aware. That self-awareness will come in. You become aware of your emotions, and then you'll be able to regard the exact situation, and you'll be able to actualize.
So the app is actually not taking anybody's job away, but rather enhancing our jobs. So we are going to ensure that every staff is properly taken care of.
Moving on, the Deputy Director of Training and Development, Mr. Dixon Dansu, has disclosed that as part of the department's agenda for the year 2023, it will be focusing on improving and enhancing the capacity and skills of staff to meet the overall objectives of the scheme.
It's an important aspect of staff development that it's essential to equip staff with the competencies that are required for the job that is assigned. You know, NHI is about 20 years now, and there are some innovations that has to take place for the growth of the organization. The Chief Executive has introduced some innovative changes that are to improve on our work ethics. And as a result of that, he thinks that it is important to organize a training program for senior management staff in order to equip them for the job ahead.
Following a recent management retreat, representatives of various directorates who were present were tasked to organize a trainer of trainers workshop for staff to disseminate knowledge gained from a training on how leadership can drive client satisfaction. The training also focused on change management adaptation and achieving results. Throughout this week, Farm Access and Leapfrog to Value, together with the National Health Insurance Authority and the Christian Health Association of Ghana, SHAG, are attending a workshop to develop and pilot new value-based care models. The workshop will analyze NHIS claims payments data, select a care pathway, and develop measurement tools based on a human-centered approach to delivering healthcare with its corresponding payment incentives to make the model viable and sustainable. The model will be piloted and its outcomes documented for further review and possible adoption in time. Value-based care is a concept that aligns patients, payers, and providers around a common goal, thereby achieving outcomes that matter to patients at optimal cost. Still on the workshop, the Deputy CEO in charge of operations, Mrs. Vivian Adokobia, praised the organizers for their continuous efforts in ensuring that Ghana has a strong and viable national health insurance scheme.
I know this training is going to help us a lot. Corporate Affairs is here, the team is here, our cherished team, we cherish them so much. SSC pharmacists, we brought all of these things together. They are still supporting NHI. I can't wait for us to, have furthermore discussions on some of the diagnoses that are coming on within the facilities.
The Chief Executive Officer of NHIA, Dr. Bernardo Kuboy, said value-based care is a panacea to the provision of better health care. According to him, the NHIA has started the process of electronically managing claims from healthcare providers.
This afternoon, we have a partnership between the National Health Insurance Authority, for that matter the scheme, and Pharmacists Foundation. What we are doing is to take a good look at the data that we have. The organization, as the National Health Insurance Authority, is now going towards electronic management of its claims process. And this electronic management or digitized process allows us now to consolidate and crystallize all the information we have about Ghanaians who attend hospitals. And once you have this data, it is now possible to have an idea of what people are presented to the hospitals with and how to take steps to handle some of these medical problems in the population. And that is where value-based care comes in. So that if, let's say, 2 conditions account for 80% of all hospital attendance, it will be in the interest of this country based on the data we have.
This week on Health Tape, we take a look at neonatal jaundice. Now, this is how we wrap up on this week's edition of NHIS in a Week. For more stories, log on to our website, www.nhis.gov.gh, or follow us on all our social media platforms displayed on the screens. Thanks for watching.